Hey everyone, welcome to The Explainer. Today we're diving into a medical situation where the clock is literally always ticking. We're talking about meningitis. When this strikes, I mean every single second counts. It's a literal race against time, and understanding how this disease works could quite literally save a life. So let's just get right into it. Okay, here's a quick look at our roadmap for today. We're going to cover 1. The brain under attack. 2. Types and transmission. 3. Recognizing the warning signs. 4. Diagnosis and emergency treatment. And finally, number 5, prevention and prognosis. All right, let's start with section 1, the brain under attack. To understand why the clock starts ticking so incredibly fast with this illness, we first have to look at what's actually under threat. Your brain and your spinal cord are wrapped in 3 super tough protective layers. We call these the meninges, specifically the dura mater, the arachnoid mater, and the pia mater. Honestly, think of these layers like your body's elite, high-tech security system. They are there to lock down and protect your central nervous system. Meningitis is the severe inflammation that happens when this armor gets breached by an infection. So when that elite security system is compromised and starts swelling up, your brain is suddenly put under immediate, massive pressure. Moving right along to section 2, types and transmission. So who are the culprits actually breaching the walls? Well, we've got 2 main offenders. On the viral side, viral meningitis is actually far more common. It's usually a lot less severe, and honestly, it often just improves on its own without any specific treatment. But then you have bacterial meningitis, and wow, this is the rapid, deadly villain of our ticking clock scenario. It is an absolute medical emergency that can progress at terrifying speeds. We're talking about needing immediate, heavy-hitting antibiotics to stop it in its tracks. Now, how do these bugs actually get to us? What's kind of chilling is how surprisingly mundane the transmission is. We're talking about tiny respiratory droplets from coughing or sneezing. It could be from kissing or even just casually sharing a fork or a water bottle. And the thing is, it spreads like wildfire among vulnerable groups. This includes newborn babies whose immune systems are, just barely forming, teenagers, the elderly, and folks living in tight, crowded settings, think college dorms or military barracks. Okay, section 3, recognizing the warning signs. I really want you to treat this part as your personal emergency checklist, okay? Recognizing these signs early is absolutely crucial. In adults and older kids, these symptoms come on so fast. You're looking at a sudden, spiking, high fever, a severe headache, and a stiff neck. Seriously, never ever ignore that combination, high fever and a stiff neck. You might also see some nausea or vomiting, photophobia, which is just a fancy way of saying you have a really severe, painful sensitivity to light, sudden confusion, and even seizures. If these just appear out of nowhere, that clock is ticking loud. Now, what's really interesting and super important is how completely different the warning signs are for infants. Babies obviously can't just tell you, hey, my neck hurts, right? So caregivers have to be hyper-vigilant for drastic behavioral shifts. We're looking for extreme irritability, poor feeding, nonstop crying, unusual sleepiness, and fever. But most uniquely, keep a really close eye out for a bulging fontanelle. That's that soft spot on the top of a baby's head. If you see that bulging, it is a massive red flag. It literally means pressure is physically building up around their brain. There is one more symptom I need to highlight, and I want to be super direct with you on this. If you or someone you love develops a purplish or red skin rash, grab a clear glass and press it against the skin. If that rash does not fade or turn white under the pressure, that is a meningococcal rash, and it is a massive medical emergency. If you see this, drop everything and get help immediately. Do not wait to see how they feel in the morning. And why can't we wait for the morning? Because delaying treatment drastically increases the risk of severe, permanent damage. We're talking about lasting brain damage, profound hearing or vision loss, learning difficulties, hydrocephalus, which is when fluid physically builds up inside the brain, paralysis, and yes, even death. The faster we act, the better the odds. It really is that simple. Let's jump to section 4, diagnosis and emergency treatment. Thankfully, modern medicine has some incredibly powerful ways to fight back. When someone gets to the ER, doctors kick off a rapid-fire diagnostic journey. First up is a super swift medical history. Then, physical and neurological exams to check for those exact warning signs we just talked about. Then come the blood tests. But the definitive step, that's the lumbar puncture, which most of us know as a spinal tap. I know, it sounds intimidating, but it is incredibly crucial. Doctors safely collect a tiny sample of cerebrospinal fluid to figure out the exact bug causing the breach. They have to know exactly what weapon to use against it. If that spinal fluid shows the bug is bacterial, the medical team goes all in.
They will hook the patient up to immediate intravenous antibiotics, heavy hitters like ceftriaxone or vancomycin, to totally eradicate the bacteria. Alongside that, they'll pump in corticosteroids to rapidly cool down that dangerous brain swelling, all while keeping the patient under strict ICU monitoring. The urgency here is absolute. Halting that bacterial attack is job number one. Now, let's contrast that intense protocol with the other types. If the diagnosis comes back as viral meningitis, the whole approach shifts. Because antibiotics literally do nothing against viruses, doctors pivot to supportive care. They help the body heal itself with IV fluids, deep rest, and managing the pain and fever. On the flip side, if it's the much rarer fungal meningitis, patients are going to need long-term antifungal medications. So the treatment plan entirely hinges on what they find in that critical spinal tap. All right, final part, Section 5, Prevention and Prognosis. Okay, we can release a little bit of that ticking clock tension now, because I want to pivot to a really empowering message of hope and proactive defense. The number one question people ask is, can meningitis be cured? And the answer is absolutely yes. Many patients recover completely as long as they beat the clock with timely medical treatment. Getting diagnosed early and taking immediate action, total game changers. But, the journey doesn't always end the second the infection clears. For patients who do experience some neurological impact, there is a very clear road to rehabilitation. Specialized therapies are total lifesavers here. Physiotherapy helps get back strength, balance, and walking. Occupational therapy helps folks relearn daily activities. And speech therapy can tackle communication or even swallowing issues. With the right support system, the human body and brain can bounce back remarkably well. Of course, the absolute best way to stop the clock from ever starting is to build up your defenses in the first place. And right at the top of that list, vaccination. Vaccines against meningococcal disease, pneumococcal disease, and Hib are just incredible scientific achievements that have drastically cut down meningitis cases globally. Combine those with simple everyday habits like washing your hands, covering your coughs, and avoiding close contact with sick people, and you are massively decreasing your risk. And that brings us to the absolute core takeaway of today's explainer. Recognizing symptoms early, seeking urgent medical care, and staying up to date with vaccinations can save lives and prevent long-term complications. It really is that straightforward, and honestly that profound. Knowing these signs literally gives you the power to act. So, I'm going to leave you with this one final super important question. Are you and your loved ones fully protected against the clock? I highly, highly encourage you to take 5 minutes today to just double-check your family's vaccination records. Make sure those shields are up. Thanks so much for joining me for this explainer. Stay informed and stay safe out there.